If you have ever tried to come off a PPI like omeprazole, pantoprazole, then you know it can be really challenging. And it's almost like a vicious cycle because maybe you get to a point where you're like, okay, I'm feeling ready to come off my PPI. And then you start to go off and you get this rush of burning either in your chest, your upper abdomen, maybe in your throat. And so you get this acid rebound effect where your body is producing more stomach acid than usual. And it can make it really challenging to come off the PPI and make you feel like I gotta get right back on again. So in this video, I'm gonna talk about the acid rebound effect. I'm gonna talk about how I personally weaned off PPIs and also some tips and tricks, some things that didn't work, some things that really helped. This video has been long awaited by you guys and requested many times in the comments, so I'm really excited to share it with you today. And just a little bit of a background on who I am. I struggled with acid reflux, gastroesophageal reflux disease, aka GERD, for almost a decade. I was on PPIs for over a year and I struggled with really severe reflux symptoms. I'm talking like excessive salivation, tons of heartburn, feeling like something was stuck in my throat, and I would wake up in the night and sometimes throw up from reflux. It was really severe. And what personally helped me was understanding that food actually wasn't causing my reflux. So I was really hyper vigilant about food. I had a lot of food anxiety. I ate like the same 5 foods every day. And I was so focused on the food and so focused on my illness that I was missing the big picture of my health. I was missing that my nervous system was completely dysregulated and this was worsening my symptoms and probably causing a lot of them. I also wasn't paying attention to my gut health, my microbiome. So I was struggling with also IBS and constipation, had to really use a holistic approach that combined nutrition, nervous system support, supporting my vagus nerve, and then also strategic supplementation, which I'm going to talk about in today's video. Today, I'm a registered dietitian and reflux specialist. So I started Flora Nutrition, which is my company that helps people overcome reflux. We have one-on-one counseling, we have an app, we have a course. So I've dedicated my whole career to helping other people with reflux because I know how it feels. I know how confusing and anxiety provoking it can be. So this is also why I started this YouTube channel. So if you have not subscribed, definitely subscribe down below because we release weekly videos on different acid reflux, IBS, gut health topics, and then also daily shorts with little tips and tricks to help you overcome reflux and feel your best. So I have a whole video unraveling my entire reflux journey and sort of how I overcame GERD, specific steps I took. But in this video, I'm going to really get down to the nitty-gritty of exactly what worked and didn't work when it comes to coming off of PPIs and how I came off of my 40 milligram omeprazole twice a day. Disclaimer before we dive in though, this is not me recommending that you go off of your medications. Definitely check with your doctor before you change any medications to make sure it is appropriate for you to wean off your PPI. There are certain scenarios in the acid reflux space where it may not be appropriate to wean off a PPI. For example, if you have erosive esophagitis, if you have ulcers, or if you have a high level of Barrett's esophagus, which is a condition where the cells have been damaged by acid and are precancerous, your doctor may recommend you be on a PPI, and that might be a safer choice for you. For me personally, I did not have any Barrett's and I did not have erosion in the esophagus. But before I weaned off my PPI, I really had to reduce my symptoms. And I talked a little bit about how I did that already, but it was really key for me to not only prevent the reflux by having consistent meal times, not overeating, not going too long without eating, not eating too late at night. I did have to remove some of the reflux triggers for a period of time, but I also needed to reduce the inflammation in my esophagus and my gastric lining. And the way I did this was really with mucilaginous herbs. Mucilaginous herbs like slippery elm, DGL, and marshmallow root are herbs that can be very useful in creating a nice protective barrier around the esophagus, the throat, and the stomach lining. So basically, I tried every single supplement when it comes to acid reflux, and these were the ones that really pushed the needle for me because I felt like I was finally able to reduce some of the hypersensitivity, some of the constant burning I was feeling in my chest and my throat and right underneath the rib cage. So I started to use those herbs, and then in addition to really managing stress, meditating daily, taking breaks, really thinking about how can I create boundaries around the things that cause me stress. It took about a few months, but it was really helpful in getting me to a place where my symptoms were around a 1 or a 2 on the symptom severity scale. and then I knew I was ready to wean off of my PPI. So that can be the tricky part for a lot of people, is really getting to a place where you're ready to wean off your PPI, and that's exactly what we help our clients do in our course and one-on-one session. But it's really important that you are in a stable place with your reflux symptoms and there's no erosion or inflammation present. And you would know this from an endoscopy. An endoscopy procedure would tell you if you have erosion, if you have ulcers, if you have Barrett's. So sometimes it is really helpful to get that work done with a GI doctor to kind of know where you're at with your symptoms. So I had the okay from my GI doctor to wean off of my PPI. I knew it was something I didn't want to be on forever because of the long-term side effects. And this is kind of controversial. You know, there's been some new research in the last few years that have disputed some of these side effects, but for me, I did my own research and I found a few things that did make me concerned for long-term health effects, one of them being bone density. So PPIs, what they do is they reduce stomach acidity. They reduce the stomach acid that your gastric cells produce, and this can impair some nutrient absorption. So it does have some risks for nutrient absorption, and long-term deficiencies can be a risk factor for certain health conditions like osteoporosis. So this is something that made me personally want to wean off of PPIs. I don't judge anyone that stays on a PPI. I'm not telling you you have to get off your PPI, but this is why I personally did decide to come off of it. I was also very young when this all was happening, and so I didn't want to be on a PPI for 60, 70 years. Even prior to coming off of PPIs, I had so many unsuccessful attempts. I would try to go off cold turkey, and then I would get that acid rebound effect, which is when your body is producing a lot more stomach acid all of a sudden, and you're feeling this reflux, this stomach acid even more. What made those attempts unsuccessful was really me not looking at my health holistically and not waiting until I was ready and rushing the process. So if I can give you one tip, it's don't rush the process. Take your time throughout this process. Wait till your symptoms are lower and you feel like you're in a good place of symptom control. And you have to look at your health as a holistic puzzle. So you could think of this as a puzzle. It doesn't matter how good at putting together the puzzle you are. If you're missing 50% of the pieces, you're never going to get that far. And that's how it is with reflux if you don't think about your stress management. Stress management is those missing 50% of the puzzle pieces that a lot of people forget about. You have to manage stress throughout this whole process because stress is a big reflux trigger. So finally, I got that missing piece of the puzzle by incorporating nervous system support, breath work, and that's really what we teach a lot of our clients as well. Your lower esophageal sphincter that connects the stomach to the esophagus is actually controlled by your vagus nerve. And if you're chronically stressed, your vagus nerve is not sending the signal to close your lower esophageal sphincter. So this is really key. Also, when we think about your lower esophageal sphincter area, we always think about the actual sphincter muscle, but your diaphragm actually plays a role as well in helping to create pressure and keep your digestive contents in your stomach, i.e. preventing reflux. So what I would say is, you really have to use diaphragmatic breathing after a meal and diaphragmatic breathing, throughout the day, maybe a breathwork practice in the morning to help effectively utilize the muscle of the diaphragm to prevent reflux. So another tip there that was really helpful for me. As I mentioned, I did remove some of the triggers, and this did continue throughout my weaning process. So I do recommend limiting the reflux triggers like spicy foods, alcohol, caffeine, chocolate. Some people are sensitive to garlic and onion. I personally wasn't that sensitive to garlic and onion, but things like citrus, acidic beverages, these things can be really triggering when your tissue might be more sensitive. If you're going through the acid rebound where you're having more stomach acid production, you do want to be mindful of the reflux triggers. And I have a full video explaining the reflux triggers here, so you can definitely check that out. Now, I mentioned I was on 40 milligrams in the morning and 40 milligrams in the evening. And so the good thing about omeprazole is it comes in multiple different doses. It's actually one of the only PPIs that comes in a 10 milligram dose, which made my weaning process a little bit easier. So I went down to a 30 in the morning. I did a 20 milligram plus the 10 milligram. The 10 milligram omeprazole does not come over the counter in the US. I did have to get that from my doctor. But basically I went down 10 milligrams of my dose in the morning and evening. So I was doing 30 milligrams in the morning, 30 milligrams in the evening, and I stayed at this dose for probably 2-3 weeks. I let myself stabilize. I continued all of my nervous system supporting activities, good nutrition, good mealtime hygiene, all of the stuff I talk about on my channel all the time. I waited until I was ready to make that next jump. And then I went down to 20 twice a day and stayed there probably for like 3 to 4 weeks. You know, this process was not a quick process. It took me about 6 months to wean off of the PPI because I had some trips and I didn't want to make the jump too soon. And so I really took my time because, like I said, every single time I tried to do it before, it was a disaster. It was too fast and my body really reacted. So after a few weeks being on 20 and 20, I eventually went down to 10 in the morning and 20 at night. Night was my most problematic time for reflux, so I hung on to that 20 milligram dose at night for a little bit longer. A few weeks went by, stabilized, and then I went down to 10 in the morning, 10 in the evening. Couple weeks, you know, continuing taking care of my gut health and my nervous system and addressing my root causes. Being patient with my body was really, really critical in this process because a lot of my clients, I can hear in session that they're just feeling frustrated. They're feeling, you know, they want to be at their goal already. They want to be done with symptoms yesterday, but it does take time and you have to be patient with your body. And then they're always so glad that they were, and all of a sudden they realize, you know, like, wow, I have made so much progress and my symptoms are really reduced, and it's really amazing to watch that process. But you just have to remember that you have to be patient with your body, and it's okay if you're not exactly where you want to be right now. Take these small incremental steps, all the little small habits I talk about in my acid reflux playlist on here. Start taking those small habits because the small consistent steps, when done consistently, lead to big results. So keep going. Eventually I got to the place where I was doing 10 and 10, feeling really good. So I dropped the morning dose of the 10 milligram and I was just doing 10 milligrams at night, continued on a few weeks. And then eventually I was just doing 10 milligrams every other day, and then every third day, and then eventually was off of that. And some people, when they're doing this PPI wean, they will use Pepcid, like an over-the-counter famotidine, to kind of supplement there and use it as needed. I personally didn't need that because throughout this whole process, I was using slippery elm and DGL to really help coat and soothe the lining of my esophagus and my throat, and that really helped me. One thing to note is you don't want to take slippery elm and DGL at the same time as your PPI because they can potentially bind to the medication, make it less effective. You don't really want to take any mucilaginous herb with your PPI. Now you're probably wondering what dose I personally took. I personally took around 800 milligrams of slippery elm twice a day, around 400 milligrams of DGL twice a day, but I do this really differently with each client depending on what their symptoms are like. One important thing to note with supplements is you should really get your recommendations from a trusted healthcare provider personalized to you because certain medications do interact with DGL. So I do find myself as a practitioner using slippery elm more frequently because there can be some interactions with DGL. DGL is licorice root. Slippery elm doesn't have any known medication interactions that I'm aware of, but you do have to adjust it based on your mealtime schedule and based on your medication schedule. So this is what we help you do in our one-on-one sessions as well, is kind of personalize that supplement protocol to you. But slippery elm is very, very safe. People are generally taking in our practice anywhere from 1,000 to 3,000 milligrams a day, and it's been very helpful in helping people wean off their PPIs. One thing I didn't have when I was weaning off my PPI that I wish I had is alginates. Alginates are an alginate supplement that creates a little gel barrier to physically prevent reflux from moving upwards into the esophagus. It's amazing. People in the UK have been using it for years, but it's more recently become a thing in the United States. So I highly recommend taking a look at this. The one that I recommend is called Reflux Raft. This is a great one because it doesn't have any added sugar. The sodium is really, really low, unlike some other brands. So I highly recommend doing that after meals and before bed to really support preventing the reflux and preventing the acid, especially if you're having acid rebound, from coming up into the esophagus. So this whole process did require a lot of discipline and sacrifice. I mentioned that there was a removal of the reflux trigger foods, but I eventually was able to add those back in. And I recommend waiting a few weeks when you're done with your PPI wean to then reintroduce the reflux triggers. Like, let yourself kind of chill and relax. Try to limit the reflux triggers. You know, it doesn't have to be a complete 100% elimination, but maybe you're thinking like a 90-10 lifestyle, 90% reflux friendly, 10% small indulgences here and there. But then when you are feeling stable off the PPI, that's when you can start to do like a slow reintroduction of the trigger foods and start really small, one by one, maybe noting where your symptoms are when you have those things so you can identify what your personal triggers are. If you're looking for more guidance on how to safely wean off the PPI, you've gotten the okay from your provider, or it's something that you really want to do, or you're looking on guidance on how to reintroduce trigger foods, definitely take a look at our reflux relief quiz down below to identify the best treatment plan for you in moving forward with your reflux relief journey. The link for that is in the description. If you are in a place right now where you are weaning off a PPI, looking to find relief from reflux, definitely check out this recent video I made on the 10 best foods for acid reflux, foods that can actually help you soothe and prevent reflux and decrease inflammation. So definitely check this out. And also, you're gonna wanna subscribe down below because we release weekly videos all about reflux, gut health, things that can help you optimize your health and take control of your symptoms. So be sure to subscribe, like this video, and I will see you in the next one.